So good evening, everyone. You're welcome to the Oet Writing Corrections at the Oet Study Body Program on the Synergy International Network. My name is Olayinka Aremu, popularly called Noskoshala. I'm your study buddy. I welcome you all to today's session. I believe you all have practiced writing, the task, writing your letters for the OET exam. So well done to every one of you that are submitted. I know it takes a lot of commitment and dedication to do this. So you're doing well. I want to encourage you to continue to put in more effort. Use your OET e-portal learning center. You have a lot of resources there. So continue to practice and check out other past corrections, other live classes as well for revisions. And there are other materials as well at the resource center. So you will see OET resources. For instance, if you open into your OET writing class, you will see resources. So you can go in there for other additional resources. Do make use of the portal. There are a lot of resources there. Try to explore as much as possible. If there is anything you come across that you are not clear about or you don't understand, feel free to always, message me. You can message me through the email, but the fastest way to reach me will be through WhatsApp. You have my number, so please make sure you are using the resources. There are so many things that you have to do. There are so many things that I know it could be very overwhelming. But if you can just plan your time and plan your day, it's going to be very, make things easier. Also try to use your study plan and make sure you keep track of your scores and putting into your student tracking, progress tracker. This will help us to monitor your progress and, to also know how you are doing. And if there's any way to re-emphasize or to refocus on certain module, this will help you in that regard. So again, you're welcome to the OET Writing Corrections on Zoom. So I'm going to be checking, revising generally what the OET writing is all about. I know you have attended the class. If you have not attended the class, please make sure you go online into your e-portal to attend the class. There will be more details there. I'm only going to be summarizing and probably emphasizing major points here. All right. So I'm going to be using some of the letters that has been submitted. So we're going to be correcting that, using it as a standard. Unfortunately, I will not be able to correct all the letters. So I understand we have almost 10 letters from different candidates there. So you can always use every point from one letter, one corrections to reflect on, the others. So just to let you know ahead of time. So I'm going to be using a particular, I hope you can see my screen, practice book, Nursing Writing. Okay, if you can see my screen, can you just say, just drop in the chat box there, that's yes, thank you. So this particular practice material, so I'm only going to be focusing on the writing. Okay, thank you so much. All right. So you know that the writing subtext usually consists of a scenario presented to the candidate, which require the production of a letter of referral or whichever category. The letter must record treatment offered to date and the issues to be addressed by the other professional. The letter must take account of the stimulus material presented. So for every letter, there's always a stimulus. The stimulus is like the call to action, what they want you to do. So like every letter, you have a body of the letter, you have an introduction, you have a conclusion. So we are expected to write within the range of 180 to 200 words. That's the the average word count. Okay, so there are different professions that have different letters. So the letter for nurses is different from the letter that a doctor will write, or from a letter that a pharmacist will write. All right, so that's just like an overview. How is your writing scored? Now, I think I had a video on this separately, or there's a section in the class. If not, I can revise that and really focus how your writing subtest is scored. So generally, the writing and the speaking assessors are monitored for accuracy and consistency. So if you have two assessors will award different scores to your mark. So like your writing will be assessed by two assessors, and they will, have a conclusion and average. For the writing subtest, each assessor will score your performance according to 5 criteria. So there are 5 criteria that you need to focus on. Number 1 is overall task fulfillment. That is talking about, are you able to cover every aspect of what you are expected to do? Did you answer every question? Is your letter detailed enough to cover everything you're required to write? Now, appropriateness of language, this is also very important. Are you using the right sentence construction? Are you using the right tenses like past, present, this kind of appropriate language? And are you being professional in your writing? Are you not using medical jargons? Because even though you're writing a professional letter, you're expected to write as simple as possible. Avoid medical jargons, avoid unnecessary abbreviations, only use the recognized abbreviations where possible. But they always tell you in the letters that you should expand the letter. So you're expected to write things in full. Comprehension of stimulus is another thing. So I mentioned what is a stimulus. A stimulus is like the major point, the major purpose of the letter. So do you understand the purpose of the letter? So there's no point you writing off record. So if you understand the purpose of the letter, you'll be able to cover it extensively. All right. Now, linguistic features like the grammar, like the cohesion, like your punctuations, use of commas and all that is also very important. Paragraphing. Are you writing, a paragraph should be more than 5 to 7 sentences or 5 to 7 lines, I would say. So by the time you're having 12 lines already in a paragraph, so that's talking about your linguistic features. So you need to be very careful. And the last one there is the presentation features. So I've talked about our spelling, punctuations, and your layout. So for every letter, there's a particular structure you should have, very neat and organized. So they're looking out for that as well. So these 5 criteria will be equally weighted. So you have, when I say equally weighted, remember that the total score for each module is 500. So you have 100 criteria. So that's how you be scored. Grade B for writing requires a high level of performance. Remember that if you want to get grade B, you need to have a range score between 350 and 450 or 400 thereabout. So please keep that in mind. All right, so again, roughly the writing subtest takes 45 minutes. For practice purpose, I always tell my candidates, I try to write within 40 minutes, practice within 40 minutes. So you have extra 5 minutes for yourself in the real exam, you understand? So it is profession specific. You take this part of, basically a nurse does the task for nursing. The task is to write a letter. Usually you have the 3 types of letter. If you haven't seen in your e-portal the samples of the different types of letter, you can let me know. I'll forward that to you. So you have a discharge letter, referral letter, or a transfer letter. So those are the 3 types of letter you might be required to write. So take note of that. With the task instruction, you receive a stimulus. A stimulus material is your case note, just like we have case notes on our day-to-day practice as nurses. So you have the case notes, and in the case notes, detailed information about the patient is in there. So now they want you to transform the case notes into a letter. All right. So you have the first 5 minutes of the test to read through the task and to comprehend, the information. So during this time, you can take notes, but don't start writing. You can underline, you can make simple notes of key things you want to emphasize on. Now, for the remaining 40 minutes, write your response to the task. You receive a printed answer booklet. I've also uploaded a copy of the sample booklet, so you can practice with this when you're writing. Just make several copies and practice with this so that you're writing, you already imagine that you're writing as an exam using the margins of the paper and all that. So I don't encourage candidates to use a jotter to write, because it won't really reflect the number. Like you want to see your word count, and an easier way to know your word counts is when you know the average number of words that you write in a line. So for instance, maybe in one line, you're kind of, depending on your writing size, some people have a very big handwriting. So for me personally, I know I write usually average of 7 words in a line. Some people write 10 words, some people write 5. So if your average is 7, and then you have written 10 lines, so in your mind, you don't have to count each word again. So you can quickly say, I've written 7 words, and you're looking at 180 to 200. So you're only required to write maybe another, 10, 10, 10. So by the time you're writing 40 words, so 70 times 4 is 280. That's too much. So that will help you to plan yourself in writing. And as you are writing, you're already having an idea of how much words you have written. So it will guide you. You don't waste too much time writing unnecessary things, because the more unnecessary thing you write, the more you lose your mark from the important things that you miss out. All right, so you have a space for rough work in your booklet, and you may write in pen or pencil. Somebody has asked me this question before, do we write with pen or pencil? Why some people prefer to write in pencil is because in case they make a mistake or they want to adjust, they can quickly rub that off and rewrite. Because if you write in pen, then it might make your work very messy and not really presentable. So you can write in the real exam with pen or pencil. So just a quick guide there. Like I said again, I'm not going to go too much into this because we have a whole class for it. That's, I would say, is even more explanatory. So go through your class, but there are certain do's for your writing success. So take time to understand the task requirements. Use your own words to paraphrase or summarize longer pieces of information from the case notes. So as much as you want to use your own word, don't over-filter the information, okay? It's possible for you to write, like, to copy exactly what is written in the case notes in certain instances, but in case you want to use your own word, don't over-filter that it doesn't really now make sense or even look like what is originally in the case notes. So make sure you understand the situation described in the case notes. I always say, try to imagine the case notes as a real life situation that you are in as a nurse, and how will you approach that? So use the space provided to plan your letter, though a draft is not compulsory. Use the 5 minutes reading effectively to understand what is your role. So it's always important when you're writing a letter, who are you? So who are you? Are you a discharged nurse? Are you a student nurse? Are you a head nurse? Are you a home health nurse? Are you a public health nurse? So this will guide you into what you should look out for. And remember that you also have to include your role as, when you finish writing, like yours sincerely, you write your name and you say child nurse. So if the letter describes you as a child nurse, then you put child nurse there. If it says you are a sister nurse, you put sister nurse there. So who is your audience? Who are you writing to? Are you writing to a consultant? Are you writing to a fellow MBT, maybe to a physiotherapist? Are you writing to a dietitian? Are you writing to a patient? Or are you writing to a patient relative? So the reason why you need to understand this is because it's going to inform how much information you put into your letter. If you're writing a letter to a consultant, that's a higher level of communication. So we're talking about vertical communication. So the higher level, the topper one. So you're writing to a consultant, maybe for specialty input. So you know that you're going to be very more detailed. The consultant, maybe the consultant does not even know the patient before. So you need to give him more information. Okay. Sorry, what is the current situation? How urgent is the current situation? What is the main point you must communicate to the reader? What supporting information is necessary to give to the reader? What background information is useful to the reader? What information is unnecessary for the reader? And why is it unnecessary? Okay, so these are the things you need to use that 5 minutes to filter and to get. You might want to take quick note there. Now, explain the current situation at the start of the letter. It is very important to know that when you're writing your letter, that the first paragraph describes the current situation of that patient or of whatever, of that candidate, of that situation. Just describe it. Is it an emergency? You need to state if this is an emergency, what do you require? We require urgent interventions or urgent, specialty input, urgent review, or, ongoing support. So the first paragraph is usually detailed on the purpose of the letter. What is the current situation? Who is this patient? This patient is so. What does the patient require? Use the names and address given. Set out the names, addresses, dates, and other information to start the letter clearly. Most of you did this very well, but there's at least some bit of corrections to make. As you write, indicate each new paragraph clearly, perhaps by leaving a blank line. So usually, please leave a blank line in between each paragraph, very important. So yeah, some other things that you should not do. Okay, so don't include everything from the case notes. I described this in the class, in the main class in your e-portal there, under 3 categories: how to select informations, how to prioritize information that you must put in your letter. So there are three levels. So you have the most relevant information, the relevant information, and the not relevant information. Now, remember, I used the word relevant. I did not say important. I did not say important. So relevant or related. So is this information really related to what I'm asked to do? So for instance, if you are transferring a patient to a nursing home and the patient was originally from that nursing home, now you are in an acute hospital and you're transferring the patient to a nursing home, it is understandable that there is a known relationship between the recipients and the patient. They know this patient before, you understand. So there's no point you writing about social history again. This patient lives here. Even if you're going to write, it's going to be anyone that is now related to the current situation of the patient. So what I say is save your words. Each letter, each word that you put in your writing is as precious as your mark. So the more words you can save for the relevant ones, the better. So don't waste your words on irrelevant issues. So treasure your words and use them to address or to write the relevant information. Because remember, one of the tasks is comprehensive task fulfillment. So don't simply copy chunks of text from the case notes. I know that, like I said, there are some instances that you have to use exact words that has been written in the case notes, but don't just copy everything like they wrote there. So use your own words. Write notes, or don't write notes or numbered points. So don't bullet. To write, you need to write it as a letter. So generally have a spare pen and pencil ready just in case. Fill in the cover pages of the task with your name and your details. Take a sample test, just as we're doing. Practice writing clearly if you have poor handwriting. I've had candidates that even though the content of their letter are so beautiful and very comprehensive, but the handwriting is poor. So there's no shameness. There's no shame in you practicing letter writing, being able to write legibly. It takes a lot, because even if you are writing the most precious thing and your examiner cannot read them, then it's as good as, not good. So write clearly and legibly. Make sure you at the end of the letter, when you're finished, make sure you check that your letter communicates what you intend. Check your spellings. That's Gina as a community. Check your spellings. Revise. Check your word counts again. You have 180 to 200. Did you write full sentences? Check all that. If your page is messy, you can use clear mark, just one line over, if in case you want to cross out any word. Cross out clearly anything you do not want the assessor to read. Okay, so that is about that. Again, just to revise the 5 criteria. So there are 5 criteria for that will be used to score you for your assessment of writing: overall task fulfillment, appropriateness of language, comprehension of stimuli, control of linguistic features, and control of presentation features. So details of these are available in the e-portal, so you can go and revise that. Okay, so this is a sample letter. So I'm just going to go straight now and let us start the correction. Is that okay? So if you have any question, you can drop it in the chat box and I'll take that. Thank you. So I'm going right now into your folders so I can get your letters. So Falake, can you drop in the task that you completed?
I've uploaded it.
So I need the question. The question, I only saw answers.
Okay. Okay. Let me quickly do it.
Okay, so I think this is Jennifer's folder. Okay, so this is a case note that you'll see that. So read the case note and complete the writing task which follows. You are Shelley Cates. So forget about your name now. This letter says that you are Shelley Cates, a qualified nursing sister working with a Star Nursing Care Agency. Natasha Dobby is a patient in your care. Read the case note below and complete the writing task which follows. Okay, so your 5 minutes is for you to read through. That's your name, that's the patient name, the address, and all that. Social background: patient is married to Patricia, is a retired professor. Patrick Doza, age 73, lives together in own house. There's the medical history. On the 17th, what happened? On the 16th, what happened? He was admitted. So next, let me go to the next. So on the 17th, had the surgery. On the 18th, shifted to specialty geriatrics and rehabilitation. What happened on the 23rd? On the 25th, discharged from the hospital. Her husband wants someone to come at their house to help her in gaining mobility and performing exercises for speedy recovery, as he is not able to assist her in walking. He uses walking stick. So now your writing task. Writing task is using the information in the case notes. Write a letter to Miss Margaret, head nurse at Dowell Hospital, ground floor, that's the address, to send a physiotherapist to the patient's house to help her in recovery soon. So I tell you that this is the simplest kind of letter you can get. So yeah, there are other letters that could be very, very much more detailed than this. So this should be a walkthrough. So let me see what our dear candidates wrote. I'm trying to look for that particular letter. Okay, I think this is it. So again, like I said, I will encourage you to download the sample formats of the real letter booklet so that you can use that. Yeah. So let's look at this address. That's the first thing. So the start says that you should write to Miss Margaret, who is the head nurse. So okay. So Miss Margaret head nurse. So one thing that is missing in this letter, in this your address, Miss Margaret, there should be comma, head nurse, comma, Dowell Hospital. So it's a Dowell, it's one word, not do well. Dowell Hospital, comma, the ground floor, comma, address. So that's the way it is. Full stop after this, NSW 2010, full stop. So is this 06-605? Is it the date of your right? So is it 605? It has to be 0605. Or you can just say the 6th of May or May 6th. Do you understand? So the 6th of May, or you can write 0605-2022. Dear Nurse Margaret. So I would say you just say, Dear Margaret. Okay, it is in Nigeria that they used to put nurse in front of all the names. Here you are addressed by your first name, and there's no nurse or anything. So, Dear Margaret, so this is a good one. The name of the patient, full name of the patient, date of birth, so 02/08/1952. Now, again, you might have to do a quick conversion yourself of the age. So what is 1952 as per age? So you put it there as the age. Okay, just put the age there to save you those long words. I just say age. How old is that? A quick calculation of 1952. If you can't do that, just leave it there. But it's always good to know the age because it can help you in your writing. So I'm writing to request for a physiotherapist in your hospital to pay a home visit to Natasha Dobby, who is being discharged home today from our facility. She was diagnosed with hip fracture, hence requires help to recover fast. Okay, not a bad one. So now let's go back and see what the task is exactly. So how do you know what the task is? How do you know what the main point is or the purpose of the letter? So the purpose of the letter will always be, it could be in the task or it could be in the case notes. You can draft that from the case notes. So if you see from here, the main purpose of, the reason for the physiotherapist is because this patient is being discharged home and she still requires support with her mobility. Okay, if we look here, it said rehabilitation in treatments initiated, offer mobilization exercises to help promote strength and recovery. So she requires rehabilitation measures, to help her promote the strength and recovery, or she requires mobilization support to help her promote strength and recovery. That's what the patient needs. Coupled with the fact that the husband, who is supposed to help, is not able to do that because he also uses walking stick. So the husband is requesting for this. Now, in your task there, they said, write to Miss Margaret, the head nurse, to send the physiotherapist to patient house to help her in recovery soon. Okay, remember that we said you don't have to copy everything that you find there. So it is really not out of place, this introduction by our dear Synergy. So you're writing to request for a physiotherapist in your unit to pay a home visit, or you can say that I'm writing to request a physiotherapist to pay a home visit to Natasha Dobby, who is being discharged from our facility. Miss Natasha, or we just say Miss Dobby, requires mobilization support to help her. What's that thing that they wrote in a mobilization support? So I'm going back and forth now because mobilization support to help promote her strength and recovery, or to help her to promote recovery. You can just be that way. So these are the words. I'm just trying to let you know how you can use the words that you already have. Okay. So she requires rehabilitation support to promote her recovery. So that is your introduction. So if you look at that introduction now, introduction should contain three major things. Who is the patient? What does the patient need, and for what purpose? What does the patient, so here the patient requires physiotherapist visits, to their home. The patient, who is this patient? Natasha Dobby. Now, usually I always want to write Natasha Dobby, 85-year-old patient, or you say a 64-year-old patient who is being discharged from our hospital. He was diagnosed with hip fracture. What other thing did she have done apart from the hip fracture? So she underwent a surgery that was successful. So I want to emphasize that also, include that in the letter. Patient has recently had a hip fracture, a surgery following hip fracture, hence requires help, with recovery, rehabilitation support. So you need to be more specific when you're writing. She was diagnosed with hip fracture. So is it the hip fracture that makes her require home visit? No, it's because she underwent a surgery as a result of hip fracture. So hence requires rehabilitation support to promote a recovery. So if you want to quickly write that now, and you just rewrite that introduction based on my explanation, that would be good. So now we go to the second paragraph. Now you want to be more detailed. So Natasha Dobby, you don't have to write the full name again, just write the first name. Natasha was admitted to our agency 9 days ago, or you can just say on the, okay? So write on the, initially when you're writing the first timeline, write the full date. On the so on the 17th, or is it on the 18th? That's on the 16th of July, where on the 6th of July 2020, as she presented with injured hip as a result of tripped over. No, so that's not correct. As a result of tripping over a loose rock, or you can just say she presented with injured hip because she tripped over a loose rock, or due to the fact that so use the most simplest word so you can save your word. The next day, she underwent a successful surgery. So yeah, that is good. So I can see you using your time reference here. So you don't have to write on total. So just say the next day, she underwent a successful surgery, and the following day, okay, also you can just say and was referred to a specialty geriatrician's orthopedic rehabilitation ward on the following day. That's a full stop. So try not to put too much word in a sentence. So make your sentence as simple as possible. Avoid complex sentences. Complex sentences are where you're using and, or comma, comma, comma. So try to avoid that. So I will write that and say that the next day she underwent a successful surgery and was referred to a specialist geriatrician orthopedic rehabilitation ward the next day. So you have used the next day before, so you are not going to use the next day again. Just say the following day or the day after. So where she commenced, so you can start another sentence there and just say she was treated, or she commenced rehabilitation treatment to promote her strength and recovery. Fortunately, after 5 days, okay, of moving to the orthopedic ward, Natasha started working with the help of her husband, but still needs extra care as requested by her husband at home. So I wouldn't say this your top paragraph is like a complete reflection, because in the case note there, he was saying, just state what the patient is. It was an extra thing that the husband, she was not working with the help of her husband in the hospital. Let's go back. Let's go back. Okay, so that I'm not misdirected. So admitted, diagnosis of hip fracture, and then she underwent the surgery, which was successful. She was referred or transferred to specialist geriatric orthopedic rehabilitation ward. They initiated the treatment. She was offered mobilization support. So she started doing well. So if you look at on the 18th to 20, that's 5 days. 5 days after, Natasha was seen walking and talking. Talking was this talking help from the husband, but requires extra care. So she was doing well, walking and talking with help from her husband. Okay, so and then on discharge, her husband wants someone to come at their house to help her in gaining. So just try to let me go back here. So fortunately, if that's the way you want to put it, so you can just say 5 days after Natasha was saying, mobilizing and talking with her husband. However, she still requires extra care, and her husband is also using the walking stick. However, she still requires. However, her husband has requested for an extra care for her, as he uses walking stick at home, So forget about, take out this address. You don't need to put them. It's not necessary. In view of the above, Natasha's husband has requested, or you can just say on behalf of husband, I'm requesting for physiotherapy to visit, or you can just say, could you kindly send in a physiotherapist to visit Natasha at home as requested by her husband? This will, help her with a quick recovery and rehabilitation support. Just re-emphasize your purpose again in your concluding statement. Okay, so not a bad letter. If you need any further information, please do not hesitate to contact me. Yours sincerely, Shelly Kate, Nurse 192. So this is a very good start. It's not bad. Okay, and thank you for crossing this out. Like I said, if there's anything in the case note that you don't want your examiner to assess, just use one stroke to cross it out. All right, so let me go back into another candidate folder. So if it's the same letter, okay, it's a different letter. Okay. Okay, so this is another letter. I'll take 3 letters. So this is the second one. So another letter here, you see that they said, assume that today's date is 15th of May, 2021. Okay. So in some, you will see it like that. So even though you are writing your letter 2022, make sure that, or even though the date you are writing, usually sometimes it is the date of your exam that will be reflected in your case note. Okay, but this time around, they've put in this letter that assume that the date, today's date, as the date you are writing that letter is 15th of May. You are a nurse in Old Town Hospital, responsible for the care of an elderly patient who was admitted after a fall, is now ready to be discharged. Okay, this is kind of similar with the last ones, fall related. So that's the patient name, that's the social background of the patient, medical history of the patient, medications, present complaint. So the present complaint is patient is disorientated and has fever following fall. Hospital admission, okay, which subjective information. So the patient reported the subjective information, the diagnosis, PTI, query cause of fall, treatment record there, and then the writing task. So first of all, I'll go and once you get a letter like this, you know what I always do? I'll go straight to the task first. Just go and check the task so that when you are going through the case notes, you know what is expected of you already. So go straight to the task. Using the information given in the case note, write a letter of discharge. So your mind already knows that I'm writing a discharge letter. It is not all the letters that will tell you the type of letter. So sometimes it requires you to look through and see this letter based on what is requested of me. Will this be a discharge letter, a transfer letter, or a referral letter? There's not so much difference in these 3 types of letter. It's just what the major difference in the 3 types of letter is that the emphasis you place, or the purpose, the way you draft out your purpose. Now, this is a discharge letter to Miss Gold, who is the head nurse. In your letter, briefly outline Mr. Gill's history, as well as your concerns and recommendations. Now, this is another typical letter that they are telling you basic thing, key thing you should include in your letter. Some letter will just say, write a discharge letter. Now, this one is saying you should outline Mr. Gill's history. So if I were you, I will underline Mr. Gill's history. First of all, underline that this is a discharge letter. Now, underline as well that the patient is going to a nursing home. Okay, and Mr. Gill's history, your concerns, recommendation. That's it, address the letter to Miss Grace Gold and all that. Now, pay attention to the instruction. It said, expand the relevant notes into complete sentences. Do not use a note form. Use letter format. You're writing a letter. This is not your nursing notes. That's what it means. It is a letter. All right, so let's go back. After this, the plan, write to head nurse at nursing home with further care required. So let's go back. So social background, this patient, a retired retail manager, he's a widower, son, no family close, living alone in his own flat. Now, let me go back to when I was talking about known relationship or unknown relationship. So this patient is going to a nursing home. That means the nursing home does not know this patient. So you know that you need to, that's why they wanted you to put details of the history of the patient, your concerns and your recommendation. So note all this. Now, some people will be writing the letter based on the way it is arranged in the case notes. They'll first of all start with social background, medical. No, that is not the way it should follow. Go back to your task, and that will help you to prioritize what information should come first. Now, this letter says that you should briefly outline Mr. Gill's history. So I will briefly outline. After you have written your first paragraph, which again emphasize the purpose of the letter. Now, quickly, can you type into the chat box, what is the purpose of this letter? What is the purpose of this letter? I wonder now, they said, this patient is ready for discharge to nursing home for temporary care. So it's ready, that's the purpose of the letter. This patient is going to a nursing home for temporary care. The patient lives alone with no home, is keen to return to own home as soon as possible. There's significant lower mobility, he needs to be encouraged. Still episode of confusion, needs assessment for independent living recommended. So from this last day, you can know the purpose of the letter. So the reason why this patient is going to a nursing home is, first of all, for temporary care in order. So how can you summarize this? To further assess the patient for independent living. So this patient is going to a nursing home for further support, for independent living, as he is keen to return to his own home as soon as possible. So it's a temporary care purpose. So let's go to the letters that you have written and see how much you are able to cover. Remember, when you're writing your letter, pay attention to the criteria for assessment. Overall task completion. Okay. So let's see. Miss Jingo, head nurse. This is a very clear handwriting. First of all, very clear, very neat. So well done. I can see your punctuations very correct. Yes, the dates, full stop. Okay. Some people will put a space between the address and the date. All right. So that's just for organization purpose. Now, dear Miss Jane, put a space between that, and then Mr. George Gale. Just put in front of it like that, maybe apostrophe or dash, and put date of birth. That is fine. There's nothing bad about that. A space. And now some people will say, should you write a heading? Now, fine. I found this in some letters, and it's not in some letters. Some people will say letter of referral letter, or say transfer letter, but I say it's not necessary. So I'm writing in respect of the above named patients. Okay, of the above named patient who presented with confusion and disorientation, treated and now fit for discharge, but need further care in your health facility. Now, I asked you to put something in the chat box. I haven't seen anyone write in the chat box there, so you might want to do that. Just scribble the purpose. What is the purpose of this letter? You have seen the case notes, right? So what do you think is the purpose of this letter? We'll be able to assess this letter properly. So I'm writing now. I want to say this. We said that your first paragraph should contain what? Put it in the chat box. What should your first paragraph consist of? The patient, purpose of the letter, and the presenting situation. Okay, who is the patient? So rather than saying the above named patient, there's nothing bad because it's still above named, 3 words. So you can just say, I'm writing in respect of Miss, what's the patient name? Mr. Gale, 84 years old, you understand, 84-year-old man who presented with confusion and disorientation after a fall. So he actually had a fall, and then confusion and disorientation came in. So who presented with fall or confusion. Now you are saying treated and now fit for discharge. So you're putting too many things together there. So he presented with confusion and disorientation and now fit for discharge, okay, but needs further care in your facility. So is it further care he needs, or he needs temporary care in your facility. That's the purpose. That's what is required. You need temporary care in your facility. So rather, why don't just say, I'm writing to transfer or to discharge this patient to your care. Okay. So at least that really states like is a letter of discharge. I'm writing to discharge this patient to your care. I'm writing to discharge Mr. Gale, a 74-year-old man who presented with so into your care. Mr. Gale ready for discharge but requires a temporary care in your facility or in your nursing home. I hope that is clear. So again, I will take questions. So we just run through this. So that's the first paragraph being detailed. I'm trying to say it in different forms so you can write it in a different way. So just make sure that the three key things are in your paragraph, because that's the main thing that that's what will attract your assessor. Do you really know what you're talking about or what you're expected to write on or to do? So the second paragraph, remember they said you should give detail of the history of the patient. So Mr. Gale, a retiree diagnosed with this, so that's fine. So just make sure, remember that you don't have to put everything in the case notes in your letter, all right? This is the next. Okay, so Mr. Davis, diagnosed with osteoarthritis, gastro, and non-specific, said to had a fall. So now my concern here is that you are putting too many things, like you're making your sentence is becoming complex. A paragraph contains related information, or you say a sentence, if you're putting sentence, have to be related information in one sentence. So if you're writing is a retiree and widower, you can make that a sentence. He was diagnosed with osteoarthritis 2003, hypertension 2009, and gastroesophageal reflux disease 2013. Oh, and then you want to put that. So that is another full stop. So continue. He had the fall. You are still in the same paragraph, you understand? So, but just try to break down your sentence. Don't have complex sentences. He had a fall while brushing a week ago, resulting to a head strike. Consequently, he became confused and disorientated. Very nice. On checking, you just say on observation, his temperature was this. His vital, just say his vital signs. You can put temperature, blood pressure were elevated or were out of range. So urinary tract infection was queried to be the cause of the fall, as the urinalysis revealed more than, okay, that's fine. Presently, patient vital signs are normal. Hypertension stresses are were managed, okay? So it's not were managed with felodipine, 5 milligrams a day, blah, blah, blah. God is self-managed with. So remember that you're writing. So most of the things you have to be like retrospective, and you have to be using a past tense, past present tense kind of. So has been. So this, I need to go back to the case note so I know exactly what. So medical history, diagnosed. 2000, I would say that you should not even mention anything about self-treated with antacid, because this is just an history. Non-specific colitis, ongoing monitoring, no treatment required. So medications, paracetamol for osteoarthritis. So those are the ones you are focusing on. Presently, disorientation and 4. Subjective. Okay. Why he fell while brushing because he felt weak and his legs gave way. Then he fell backwards with a strike. I didn't find this in your letter. These are very important because the main issue is about 4. He was 5 hours lying on the floor. These are very important things. And one of the neighbors called for ambulance. 2 weeks before the fall, he has had single episode of vomiting, palpitation, and diarrhea. So on observation, it was noted to be confused and disorientated. Temperature, there's nothing but you can write these specific numbers. Temperature was high, okay, or was 38.1, BP was elevated, and the pulse was normal, respiration was elevated, and the urinalysis shows, just like you put it. Hence, a diagnosis of UTI was made as, queried the cause of fall. So I would say, apart from the history, it's very important that you focus more on this part as well, the subjective and objective information. So the patient was managed with IV antibiotics. This, I'm not looking at your letter now, if I'm the one writing this. He was managed with IV antibiotics, amoxicillin, to continue his regular meds. His regular meds actually was paracetamol and felodipine. So on observation, he's no longer dizzy and no palpitations was noted. His vital signs are now normal. So today, remember they said that the date is 15. So you can reference that and say, patient is not ready for discharge today to nursing home for temporary care. However, there are some concerns that have been noted because this patient lives alone and he has no help, although he is keen to go home as soon as possible. However, he will require, support and encouragement with physical activities because he has significantly, his mobility has significantly reduced, about 30 minutes per day. He's still having episodes of confusion. So he will need assessment for independent living, at home. Therefore, it will be really appreciated, or it will be greatly appreciated if you can, provide him with further care as required in your nursing home. So that is me running through it in my head, just looking at it. So let me go back to your letter again. So again, just as I'm saying, if there's anything that you are not clear with or you feel like you need further information, explanation, please let me know. So again, I just want the logicality or the logicality of the organization of your letter is also very important. So even though they put hypertension or osteoarthritis as self-managed, they were managed with felodipine and all. That's like an history, okay? It's history. Now I see that you are bringing in history after your observation. So try to organize your content together. Finish writing history before you go into, the current situation or the most current situation and then the current situation. So look at it this way, especially for this letter. You started with the purpose of the letter, which is here. You started with the purpose of the letter, then you came into the history. So after the history, go to the treatment and management and all that. That should be your third paragraph. Then the fourth paragraph should now be the present situation. What does the patient require? What is happening? That's talking about now that the patient is ready for discharge, requires this. These are your concerns. So that should be your fourth paragraph. And you have your fourth paragraph will lead you to your conclusion. So remember again, you can have 3 paragraphs and 1 conclusion paragraph, or you can have 4 paragraphs and then 1 tiny, maybe 2 lines conclusion paragraph, then your ending, that's your name and all that. So let me look at your last paragraph here. It's required to assessing for independent living recommendation. So, and 30 minutes daily. So I think this is a misinterpretation of information there. So what it says that this patient has limited mobility, and that's my understanding of the case note there. Okay, so this is your concern. It's significantly lower mobility. That means that he only works 30 minutes per day. So we need to encourage him to work more than 30 minutes per day. Do you understand? So usually his mobility has been lowered, but he needs encouragement to work more than, that's the arrow there. Can you see the arrow? To work more than 30 minutes per day. All right. So, and again, he still has episodes of confusion, so he needs assessment for independent living. You don't have to put recommended again. You understand? Remember, we said don't copy and paste. You use your own words. So, like I said, this patient still had, you're talking about this concern. So he still had episode of confusion, or he's still confused. Sometimes you can put it as simple as that. This patient is still sometimes confused, or is still confused occasionally. So you see, I'm using another word to represent episode. So occasionally still confused. So we require assessment for independent living. It would be greatly appreciated if you can continue, provide further care as required for this patient. So that is how to write it. So just try to use your own word and play around with the words. Don't write it the same way it is put there. And imagine, that I said, always imagine if you are actually the nurse looking after this patient. What will you say? How will you interpret this? You understand? That's what they expect you to do. Okay, we are running out of time there. I still want to take one more letter. Then, yeah, that's fine. Your conclusion, and then you sign out. That's it, sincerely. So if you still have enough word counts, if you write any letter, can you put your word counts there after you write it? Put it just under your letter there. So if you still have time, you can say, should you require any further information? Or you can say, I have attached further details or further information for your review or for your information. I've attached here, other documents or other details of the patient for your review. Or you can say, should you require further information? In case you feel like you have a letter that has just too much information and you can't get them in, you can use that as a cover up for yourself and just say, not like that would be marked, but at least you are conscious of the fact that you might not have covered everything. Okay, so that's about that. I'll take one more letter from Lizzie. Okay, Lizzie, I can't find any question here to reflect on, so I'm going to go into somebody's folder. So the same way, let me just run through it, because there's no case notes. I don't know what letter you wrote, so I will not be able to know if you had overall task fulfillment. But just merely looking at this, the address, don't forget the punctuations in your address, date of the date is okay. 05, just make it like double 0505. Dear sir or madam. So why are you writing sir or madam? Was it not specified? Now I can't, that's because I don't have this case note. I don't know which case note. So was it not specified if it's a Mr. or is a Miss that you are writing to? we have some cases like that it might not be specified, so you're allowed to use dear sir, madam. Okay, or you can just say, if it say that is a manager or is a doctor, or dear consultant, dear physiotherapist. So if a name is not given, okay. Date of birth, 18 June. I am writing to request for home visits for. So now you said I'm writing to request for home visits to. So you are requesting for home visits for Mabel. Okay. So I'm rewriting to request a home visit for Mr. Mabel, who is recovering from right knee injury following fall from stairs. He has been discharged. He has not been discharged, but require continued care. I tried to, rephrase that because you just say he has been discharged, full stop, and it's require no. So you can make that into one sentence. He has not been discharged, but requires continued care. So that's the purpose. Mr. Mabel so instead of saying Mr. Mabel, just say on 12/9/2011, Mr. Mabel felt extreme headache in the morning, which made him fell off the stairs and injured his right knee badly. Yeah, so I just put that date in front first on so Mr. Mabel, blah blah blah. After 2 days, the left knee was redressed and no infection noted. Was able to walk little distances with help from his wife. He also complained of pain while walking. Mr. Mabel was revealed on, so I will bring that into a different paragraph, or since you are starting something, another what will I call it now? Subject. So on 19th of July, or you can say rather than on 19th of July, this is 12th. So after 2 days, you're waiting 2 days. So that is 14, right? And then 14, you have 5 days. You can say 5 days following this, but it's not bad if you say on the 19th as well, since you have used a time frame word, because that's what we call it. So you should be able to use time frame, different time frames as well. So 19th of July, and his knee healed well, and I can't really see that. Suggestions to walk were walking sticks. Sorry, I can't really see that. So Mr. Mabel was revealed on 19 July 2009, and his knee healed well, and suggestion to work with walking was made. So now this is too much, and okay, that's why I said it may be possible for you to start it in another paragraph. So just say on 19th of July 2001, Mr. Mabel's knee has healed well, but it was requested, or suggestion was made for him to walk with walking aids. So because that sentence it's not sounding right. So furthermore, is Mrs. Mabel requested for more home visits. So that will not be a furthermore. So furthermore is not appropriate in that situation. So you can say, however, his wife, Mrs. Mabel, is requesting for more home visits in order to bring more improvements in his mobility, or just saying in order to help him improve more, in order to improve his mobility. Okay, so again, like I said, save your words. So I've kind of helped you to say 4 words in that sentence. So his wife, Ms. Mabel, is requesting for more home visits to improve his mobility. So I've taken out more, I've taken out in order. So I've saved you 4 words there. Okay, so Mr. Mabel medical history revealed that. Why are you just talking about medical history here? So I will talk about this medical history after the first paragraph so that you can focus more on the other content, okay? Remember I said that emphasize more on the most important. You can have more time to focus on the other content. So move this third paragraph to, after the first paragraph. Then you can talk about this flow. So in light of the above, it would be highly appreciated if we could make our time to visit Mr. Mabel at home for easy recovery. So again, who are we writing to? So this person you're writing to is a physiotherapist. Okay. So in light of our above, it would be highly appreciated if you could visit Mr. Mabel at home to help him or just to assist him with recovery, activity, or to help him improve his mobility. That's the main thing. So if we say at home for easy recovery, that does not really focus on the purpose. So the purpose of this is to help him improve his mobility. So to be appreciated if you could, visit Mr. Mabel at home, make a time to visit Mr. Mabel at home to help him improve or to help improve his mobility. Okay, if you need further information, don't hesitate to contact me. So that is about that. Jennifer keeps coming in and out, maybe due to network. All right, so let me see so that I have to cover everyone. Let me see what Lizzie writes. Okay, because we have this case note, so I can just go through it. Again, punctuations here, full stop after here. That's their dates, that's the dear Miss Margaret. Okay, that's fine. I'm writing to request for assistance of a physiotherapist for a speedy recovery. Okay, so I'm writing to request for assistance of a physiotherapist. So you're not required. Just say I'm requesting for a physiotherapist. Okay. Are people going in and out of the class? It's Jennifer. So you are requesting for a physiotherapist for, I think I've revised this, so just use the revision that we have said to rewrite this. Your writing is very good, very legible and clear. And your paragraphs as well are clear. You put space in between, that's fine. Okay, not too much word in a paragraph. I think Jennifer is finding it difficult to get into the class. So Natasha Dobby showed signs of osteoporosis. We'll talk about this, so I'm not going to waste too much time on it. Let me see if there's another letter. I think that is all I can see in this. Okay, there's another one. Alfred Billy. Okay, this is the Alfred Billy one. So we can use the same, my explanations, just to address this. I'll take time to give score to these letters. I'll answer that question. Let me just go through this folder. So Alfred Billy. So what I'll request you to do based on this correction, just go back and check your letter and see, do I need to adjust anything in my letter? And it would be really good if you can rewrite whatever thing you have observed that needs correction, okay? It will be really, really good. So one thing I've quickly noted here is past medical history. So why are you writing P as, capital letter, M, capital letter? So it's supposed to be, apart from Mr. Billy. So past should be small letter, continuous, use a continuous things there. Past, small letter, M, small letter. So Mr. B's past medical history is unremarkable. What do you mean by unremarkable? Apart from his current state of health, which is well taken care of, patient is on the following tablets. So, or is on Panadine for 500 milligram and no complication noted during his hospitalization. So again, I think I mentioned this relevance or relatedness of information in a paragraph. So if you're talking about past medical history here, I don't know, I can't find the case notes anyway, so I don't know exactly what you're required to write. But make sure that in a paragraph you have related information. If you're talking about medical history, it should be in one paragraph. Now you're talking about medication that the patient is using during hospitalization. So this is like treatment and it's different from past medical history. So try not to compound it, complicate it. There's no complaint and he is fine at the time of discharge, hence was discharged on this. So is this all this letter is all about? I wonder if there should be more information in that letter. So this is still talking about him, diagnosis of skin cancer. So I think what he did was organizing your letter. The organization of your letter, you need to reorganize the letter, okay? Reorganize the letter, this particular letter, you're putting C before A. So if I see that the case notes, that will have helped me. But if I understand there, you are referring this patient, I'm going to refer the above mentioned patient. So I've addressed this, please don't write there, but just I'm writing to refer Mr. Billy, a 52-year-old man, okay, who is recuperating in a facility and will need your continual care and management after his discharge. Okay, that's not too bad, even though I can't see the case notes. He was admitted on the, so can you not just say was admitted on 21st of March 2010? Following his arrival, what was he admitted for? So what was he admitted for? I expect that should be in the case note. So tissue sample was collected from skin for pathology study. Patient result retrieved. I wish to see this case note so I'll be able to advise if you have enough content. And it's not really clear enough. All right, so I think I'm just going to stop sharing from there. I'll answer this question and I'm going to ask you if you have any other question. So in case you cannot make up words, okay? You cannot make up words. You have to write only what is available. Don't make up words. Don't bring in anything that is not in your case notes. So even though the content of the case notes is small, so that's why they say you should expand. Expand does not mean that you should import. Don't import information. So write within the content of your case notes only. Don't add to it and don't take away too much from it. All right, thank you so much. Does anybody have any question? If you want to unmute yourself, use the raise hand button. I will entertain that. If you're watching this on YouTube or any of the channel and you have any question, please drop your question in the comment section. We'll try as much as possible to answer your questions. Thank you. I invite Elizabeth. Lizzie, ask your question. You can unmute yourself. So unmute yourself.
Thank you, Ma, for this wonderful opportunity. Ma, please, ma, where do we start counting? That is the word count. Is it immediately after regarding
Yes, so
or regarding?
your word count starts from when you start writing your paragraphs.
Okay, and ends here, ma.
Yeah. And it ends when you in your conclusion. So where you write kindly, or if in case you require further information, that is not counted.
Okay.
You understand? So your conclusion, sentence,
Okay,
or
in view of
paragraph.
the above.
What?
In view of the above.
No, yeah. So in view or wherever you conclude that we require you to do this, that's where it ends. So if you write that should you require further assistance, that one is not counted.
Okay, thank you.
That's just courteous, you understand, but it's not usually counted.
Okay, ma. Ma, please, the other ones is just a request, ma.
Okay.
Ma, please, you promised to forward the sample of types of letter.
Yes. I said check into the resources. It's available in your writing resources via the portal.
Okay, ma.
It's right
Likewise,
there.
the letter format.
Yes, it's right there. So if you are finding difficulty with it, you can let me know through WhatsApp and I'll forward it to you.
Okay, ma. Thank you, ma.
Okay.
God bless you.
Does anybody have any other question regarding writing?
Yes, ma.
Okay, go ahead.
Hello, can you hear me, ma?
Yes.
Okay. Thank you very much for the corrections. I really appreciate, ma. Ma, please, this issue of history, as in medical history, you said I should not put it the place I wrote it. That will it be after the first paragraph I will write it, or after the second paragraph?
So I try as much as possible not to. I don't want you to cram the outline, because the outline of one letter differs from the other, depending on what you are asked to do. Sometimes the medical history might not be the most important. So it might actually have to be maybe very few lines. For instance, if you are writing to a consultant that does not know this, the consultant will be very interested to know the medical history of the patient. So I will start writing medical history in that case as a second paragraph. Do you understand?
Okay.
So, but in some other cases, the medical history might come after you have talked about the presenting situation of the patient. In an emergency, we are writing an emergency situation. What is very important is the presenting situation, like the observations, and that will come as a second paragraph. Then your medical history can now come as a third paragraph.
Okay.
But definitely not the last paragraph.
Okay.
So there is no specific outline on what should be in one paragraph or what should not be. You understand? What should be your first paragraph? Well, of course, you know that your first paragraph must be, establish the purpose of your letter.
Okay.
And then the last paragraph or maybe a last sentence must reestablish the purpose, like what you are looking for and why you are looking for what you are asking for. So if a patient requires mobility assessment, why? Because this patient cannot walk alone or with mobility, hence requires mobility assistance. So that is your concluding paragraph. So kind of your introductory paragraph and your concluding paragraph should, kind of reflect the same thing. Anything in between is only added information that, that is further explaining what the purpose of your letter is. So just consider that you have what should be in your first paragraph, That one is standby. You have what should be in your last paragraph. Now, the second or third paragraph, or maybe it's 2, 3, 4, if you're having 5 paragraphs, depending on your writing size, depends on the situation or what you're asked to do. If you, sometimes you have to write social history. The social history can come as, a second to last paragraph. Sometimes you might merge your medical history and your social history together in one paragraph.
Okay.
So that's what I'm saying. The more you write, the more you got exposed to different scenarios, you understand? And then you'll be able to say, okay, this is how I will address this. If it's a discharge letter, if it's a referral letter, this is how I will address the different situations. So that's how I will answer that question. Is that okay?
Thank you, ma'am.
All right. Any other question? We are way far past time.
Yes, ma'am.
Pick one.
Ma, please, how do you know the most, okay, you just explained. I'm asking on the most important relevant notes. Okay. You say in case of emergency, you start with the presenting
Situation.
information.
Yeah.
Okay. So, ma, please, can you give me example of another one?
So the example, I will still refer you back to the different letters, case notes. Okay.
Okay.
So if you are writing, let me look at the patients that, what's this common one? Okay. You have a patient that comes to ED or to your hospital and now requires ophthalmology checkup. Okay, this patient, you are referring, this is a referral letter, you're referring this patient to an ophthalmologist because the patient needs eye check and, and all those things. So in your first paragraph, you have stated the reason this patient was admitted due to suspected glaucoma, whatever, eye pain, redness in the eye, and so. And now requires, you are referring this patient to an ophthalmologist for expertise, for expertise management. Now, the next thing that will definitely come will be medical history. Do you understand?
What, ma?
Will be the medical history of the patient.
Okay, ma.
So this is the medical history of the patient, so. Then you can now call that patient presented at your unit with this, or you can even start with this is the way the patient presented, this is what you have seen, objective and subjective information. Now, coming back to say like, this patient has a background of this and this and this. A little bit of social history there because the doctor does not know, the ophthalmologist does not know this patient. And come back and re-emphasize on the presenting situation. So at this time, this is what the patient is undergoing. This patient you have done, this is what you have done to manage the condition, but you still requires further, expertise management for this case, hence the referral. So
Okay.
that is another scenario. Do you understand?
Yes, ma. Thank you, ma.
All right. So thank you very much. We spent almost 2 hours. So again, go back to your e-portal and go through the writing. There are lots of resources and assess that. Continue to write. Don't get tired. Like I said, I should be able to, revise your writings. Just keep uploading it into your folder. And I will score it as much as I can. So if you write 20, don't expect that I will assess 20. So I will assess, we've done some today anyways. So just know that you are writing to get a big plus, okay? God help you. And remember that for each criteria, you have 100, so that makes 500. So you should be hoping to get, 100, even you can just look at, can I get 70 in each? That's making 350. Can I get 80 in each assessment criteria? That's making, 400. So aim at that. God help you.
Okay, ma, please. This issue of when you log in at times, you be denied access. I don't really understand it. It just was making me uncomfortable.
Okay, so I don't know. Are you referring to the website login or the folder
Yes, if you
login?
want to log to do some assessment, like I wanted to open a reading. Yes. No, right. It was writing practical, practice 2. And I
Okay.
was told that I cannot access it.
Okay, just
I'm
screenshot
I'm
what you
having
find there
the
and
same
then I can
problem, ma.
address that. What?
I'm having the same problem, ma.
Okay, screenshot it then. Oh, possible that probably the folder, the file has been moved somewhere. So I'll check with the technical crew and screenshot what you find there. Okay, we can address that.
Okay.